Hi everyone, today I'm going to talk about recovery versus sobriety. Stay tuned. So, sobriety versus recovery. Is this going to be a bit of a controversial topic? I really have no idea. I guess I'll wait and see what comments and feedback I get from all of you. But I did want to tackle this topic because I think it's one that often actually can hinder people in their wellness journey and can create some confusion and expectations, pressure, which are never good for our relationship with ourselves. So, what is the difference between recovery and sobriety? Sobriety is the pursuit of abstinence from whatever problem behaviors or substances have been an issue. So, for some people, they might be pursuing sobriety with alcohol, or with marijuana, or with gambling, or with certain aspects of sexual behavior, certain aspects of relationships, maybe trying to be sober with caretaking or people pleasing, not speaking up for their needs. People may be pursuing abstinence from other drugs, whether that's prescription medications or other street drugs. There's lots of different behaviors that can pop up that can be problematic for people. The goal to reduce use is what I would deem sobriety, so that pursuit of being sober. Now, what is recovery? Well, recovery can or cannot involve sobriety. And that's where it becomes a little bit interesting that recovery and sobriety can certainly be bedfellows. And as a professional who specializes in addiction counseling, I do recommend that people pair recovery with sobriety because that's a very powerful combination for health and wellness. However, that may not always be of interest or of desire or what the individual is looking for. So, can we still pursue recovery even though sobriety may not be part of the picture? I would say yes, that recovery involves a greater quest for wellness in other areas of self. So, generally, recovery involves taking care of oneself differently in your physical health, your emotional health, your cognitive health, your mental health, your spiritual health, whatever that means for you. And it can also involve relational health, cultural health, as well as financial health. Not sure if I've missed any areas that are important to us as human beings, but I think that's a pretty good groundwork. So you can even hear from those categories, those are big categories. There's a lot in there. That physical health alone has so many different aspects. We can look at our sleep, we can look at our hydration, exercise, nutrition. We could even say that stress management and dealing with that is part of physical health. So each of these categories is just a wealth of different things that people can do to look after themselves. Where do people start? Start anywhere, start wherever you can at making the changes that are important to you, that are possible for you. Just start taking that next step of action. This is where professional support can be helpful to help you identify what are the realistic next steps for you, because sometimes our brains tend to overshoot the mark, perfectionism much, and sets up these really high expectations for us, which can be a bit defeating and can really get us down when we're not meeting those. Well, it's kind of hard to jump to the last step on the staircase if we haven't actually walked up the other steps in between. So having some people, whether those are peer supports, friends, or professional support who can help you identify what is that true next step on the staircase can be really helpful. So these are all action steps that people can take for health and wellness. I personally believe that we all need to do these just as human beings. So even if you don't identify having addiction or a mental health symptom, these are still important things to do for personal growth and for your own health and wellness. If you do identify as having addiction or a mental health issue, then they become even more necessary because these are your tools and your lifelines to an improved quality of life and to be able to navigate those symptoms. So where does sobriety fit into this? Well, it can very much be a part of the package. Some people are very clear that they want their improved life and they also want abstinence, so they pursue recovery and sobriety. Some people will use the term recovery to also encompass that behavior of abstinence or sobriety. Other people do the same with the term sobriety. They may use that to talk about abstinence as well as this process of recovery. That's fine. The linguistics of it are whatever is personal and meaningful for you, but just being aware that those terms do have a personal meaning to each individual, and it's important to check in if you're talking with somebody who's saying, well, I'm sober. What exactly does that mean to them? Because it may have a different definition for them than what you would think of. So it's just important to be aware that both the pursuit of change with specific behaviors, problem behaviors namely, as well as the pursuit of health promotion are both necessary components for health. However, it is possible, and I've seen this happen very often, where people can be sober but still miserable because usually they're not really doing much for their recovery or other parts of their health. In the 12-step program of AA, this is referred to as the dry drunk. So somebody who emotionally is still very unhappy even though they've pursued abstinence. And usually what's missing there is that recovery or health promotion engagement. I've also seen people who are in a pretty solid state of recovery. They're really putting the work and the effort in to look after themselves, but they're not sober. So health is all dependent on the individual, what's okay for you. Usually those folks who are in a pretty healthy state, an active state of recovery, are still wanting to pursue sobriety of some sort. They're just at a point where their addiction is so active that that's not possible for them. Ultimately, your journey is yours. So really identifying what your personal goals are. If it's more to improve your quality of life and focus on those health promotion behaviors, so more on the recovery side, go for it. I fully encourage you and give you that permission to just go and explore whatever you need to take care of yourself. However, if there are problem substances or behaviors that you aren't addressing or pursuing sobriety on, just be aware that at some point you may start to feel you're hitting a ceiling with your recovery and health promoting behaviors. And that's because it's hard to get the fullest benefit out of those action steps when problem behaviors or substances are still in the mix, because those really mess with our brains and it makes it hard to fully kind of connect and get the value and benefit that we're looking for out of those steps. So it doesn't mean that the recovery actions you're taking aren't helpful, but it does mean that it will probably be hampered at some point by those behaviors. So just something to think about is that difference for you between recovery and sobriety. And I hope that you will take whatever steps you can and whatever steps you need to look after yourself in your journey. Thanks so much for spending some time with me. Take care and bye for now.